Good evening, everyone, and thank you for joining me on this very wet and cold Melbourne evening. Tonight, I am very, very lucky that we are joined by Zoe Milgrom, who is the founder and chief clinical officer of Eugene Australia. Tonight, I'm going to talk with Zoe about genetic carrier screening. And whilst genetic carrier screening is optional, as an obstetrician, I offer it to every couple that I see for pre-pregnancy counselling or at their first visit in a pregnancy. It's a relatively complex area for people that haven't heard of it before, and that's why I thought that tonight it would be ideal if I could be joined by an absolute expert in this area who can try and sort of make it understandable for everybody, because it is such an important topic in my opinion. I think a lot of you know a little bit about the topic from having heard about Mackenzie's mission, and Rachel Casella has just published a book which is an absolutely brilliant read, and I can't recommend it highly enough. So I'm going to see if Zoe's able to join us now, and we'll start our chat shortly. Hi Zoe, how are you?
Very good. How are you, Scott?
I'm really well, thank you. Managed to work out how to join me tonight.
I did, thank you.
Excellent, you did brilliantly. How's your week been?
Very busy, and you?
Excellent. Likewise, I think that things haven't really slowed down much for us at all at the moment, and I'm sure you're seeing the same thing, that couples are still planning pregnancies and trying to get pregnant and are pregnant, and I'm sure that your job is busier than ever, really.
Yes, it is. It really helps being online, making it accessible to people from the safety of their own homes. So we've definitely seen a growth.
Brilliant. Fantastic. Well, as I said, thank you so much for joining me tonight to talk about what I think is a really, really important topic, and a topic that I think a lot of people don't actually know much about. And I thought that being able to have an expert like yourself share your insights would be just so useful for couples that are either planning a pregnancy at any point within the next sort of 12 months, or already trying, or early in a pregnancy, because it's certainly not too late to test at this point in time. But if it's all right with you, I thought that we'd sort of go through things from the beginning tonight, and I sort of think it might be useful for you just to tell everyone what genetic carrier screening actually is, and what it means.
Sure. So genetic carrier screening is basically a checkup of your genes. When couples are planning a pregnancy, it helps to have genetic carrier screening because it can help identify if any genetic variations are carried by members of the reproductive couple. And if those variations are shared, it can impact the health outcomes of a pregnancy. So basically, it's an opportunity. It's a very targeted genetic test. It can screen from up to 1 to hundreds of genetic conditions. These conditions don't affect the people or the prospective parents who are being screened, but it's rather an opportunity to identify if they are healthy carriers of genetic variations that, if they were passed on, could significantly affect the health outcomes of a child.
Right. So, Zoe, what does it mean to be a healthy carrier of a condition? Will people have any symptoms, or they know that they're carriers? How do they find out? What does it mean for them?
Yeah, that's a really good question. So there's absolutely no way to tell what a person is a genetic carrier of, particularly if it's a recessive or an X-linked variation carried by a woman. And that's because they don't manifest any symptoms. The beautiful thing about genetics is normally statistics are in our favor. So we actually inherit one copy of each of our genes from each of our parents. And in many cases, we only need one copy of that gene to function to maintain our health. So there's no other sort of tests that would pick up if you're a carrier or a healthy carrier of a genetic condition other than a targeted genetic carrier screen. And we know that all healthy people probably carry between 3 and 5 of these recessive variations. And generally, there's no clues to identify them as carriers other than testing.
Fantastic. And can you tell us a little bit about the different tests that can be offered to couples who are either trying for a pregnancy or early in a pregnancy? What are we actually looking for? What sorts of conditions are we screening for?
Sure. So in general, all of the different tests that are available are targeted genetic tests. So they're genes that are carried among different members of the population. Some are community specific and others are generally seen across all different ethnic groups. But these are genetic conditions that, if they were to be passed on to a child, would have a significant impact on the quality of their life. They could be born with physical disabilities, intellectual disabilities, or a combination of the two of them. And in general, they're really devastating for couples if they're diagnosed, and it significantly changes the way they would raise and support that child.
Absolutely. So very useful information.
Yeah.
Absolutely. So I thought it might be a good idea, if it's all right with you, to pick a condition that's screened for and sort of talk a couple through the process. So, for example, and given that I've spoken about Mackenzie's mission, if we use spinal muscular atrophy as an example, what's the chance of someone in our population being a carrier of spinal muscular atrophy? What's their risk, therefore, as a couple of having a child that's affected? And if a couple who are planning a pregnancy find that they are both carriers for that condition, what can be done about it?
Sure. So using spinal muscular atrophy as an example, we know that roughly 1 in 40 people are healthy carriers of a variation in the SMN gene, which is just the name of the gene that causes spinal muscular atrophy. And that's relevant across all ethnic groups. So if you imagine that you've got 40 friends around you, which I'm sure everyone will be hoping and with bated breath when COVID leaves our shores, to be able to celebrate with so many people, it means that one person in that group will be a healthy carrier, and there's no way to identify that. In general, both members of a reproductive couple would both need to carry a variation in the same gene. So if you work out the maths, it's 1 in 40 times 1 in 40, and a child would only be born affected by spinal muscular atrophy if both parents passed it on. So it's actually, again, times 1 in 4. So I think like 1 in 1,600 times 4, which is 1 in 6,400, I think.
Good.
Don't test me on my maths. But generally, if a couple is identified as being at risk of having a child with spinal muscular atrophy, there's a 1 in 4 or 25% chance that any pregnancy they had together could inherit both variations and be born affected by the condition.
No worries. And I'm going to come back in a short while to what couples can do if they find out they are carriers for a condition.
Absolutely.
But before we get to that, just a couple of other questions. Zoe, a lot of couples come to me and they say, Scott, there's no known family history of any of, significant genetic condition in either family. And they feel quite reassured by that. Does that reassure you as a genetic counsellor, or do these couples still, benefit from genetic carrier screening?
Sure. So 90%, to throw some statistics into the mix, 90% of children who are born with an inherited genetic condition don't have any family history of it. And that's because these are recessive genetic variations that are passed down from generation to generation to generation. And generally there's no clues, because it's all about the unique reproductive couple about whether they're going to have a child that's affected by a condition. In general, when people aren't related, the risk of having, being identified as a couple who are at risk of having a child on a large panel like the one that we offer, the chance is about 2% of sharing a genetic variation. So there is a significant chance that you may be picked up. The more genes you test, the greater the chance.
Absolutely. So if we sort of move on to now the different tests that are actually available, I think the two that I offer my patients, or that I talk about, are Eugene, which is the brilliant test that you have founded. It's brilliantly run, and we'll get to sort of the actual sort of precise details of it shortly. And the other one that I offer is Prepare, which in Victoria sort of, I think, tests for the 3 most common conditions that couples sort of want to know about: cystic fibrosis, spinal muscular atrophy, and Fragile X syndrome. Is it possible for you to compare the 2 tests for the people watching tonight, so they have an idea of what the differences are?
Absolutely. So the 3 gene test, or the Prepare test, as a lot of people know it by, is a really good basic genetic test. It does screen for 3 of the more common genetic conditions found in the Caucasian population, but it's certainly not extensive. So for a lot of couples, it's a really good entry option, keeping in mind that genetic carrier screening doesn't attract any Medicare or private health insurance rebates. So it is a consideration for a lot of couples. But I guess the difference between a 3 gene test And the test that we offer at Eugene is that we include those 3 genes because obviously they're incredibly important to be screened for. But we also know that there are specific genetic variations which are more common in different ethnic groups. So if you think about the Greek community, thalassemia is a really important gene that's commonly carried in these populations. Or if you think about the Jewish community, we think about things like Tay-Sachs disease or Bloom syndrome or Gaucher disease. And then if you think about other communities like the Asian regions of the world, which make up such a huge proportion, we don't actually know as much about them, which is a little bit upsetting. But offering a larger panel like the one that we do is really ethnically inclusive. And we think it's important with the Australian population, where so many couples come from mixed ethnic backgrounds, that we use the power of technology to screen for more, so we have better chances of picking up carrier couples.
Absolutely. And you've mentioned the differences in terms of the number of conditions screened for. What are the technical differences between the 2 tests in terms of the sample collection, cost, timing for results, those sorts of things?
Sure. So the turnaround for the Prepare test, first of all, the Prepare test is normally a blood test, although sometimes saliva is possible. In general, I think it's about $385 to screen a woman, and the approach is generally to screen the woman first, and then I think results are turned around within about 10 to 14 days. And if a woman is picked up as a carrier, then there's an opportunity to screen her partner for the specific gene that she's a carrier of. The way we approach it is we're all about convenience and accessibility. So we use saliva samples, we ship kits to people's homes. It's $749 for a couple, so it's a little bit more expensive. We do generally recommend screening for a couple because the turnaround is 10 to 21 working days. And we're really mindful that timing is really, really important, particularly if couples are having screening when they're pregnant already. So in general, we try and get results to couples as soon as possible. And we're mindful that when we do screen on these larger panels, there's a 70% chance that a woman will be picked up as a carrier of one of these variations. And so in many cases, that couple result is really, really paramount. And we know that sitting on a result and having to wait for a second result, sometimes several weeks, is incredibly anxiety provoking. And so we really believe in that couple's approach to testing.
Absolutely. And I think the other great thing about Eugene, a lot of my patients opt to have it done. And I think, the involvement of genetic counsellors in the process is fantastic. I certainly go through, my take on what genetic carrier screening is with the couple before they embark upon the test. But I know that yourself or one of the other genetic counsellors with Eugene always speaks to them before the test is done, and again with the results, to keep them completely informed about their own genetic sort of status.
Yeah, absolutely. We're really, really passionate about supporting each couple as an individual and making sure that they understand what the potential outcomes of genetic carrier screening is and what those options might look like for them. Having an understanding of what their preferences are and their beliefs really helps us to support the couple when we give those results back.
Definitely.
And we make sure that we always spend a lot of time talking about what those results are and what they mean, not only for the couple and their plans, but also sometimes for their extended family, because we know when we pick up variations in an individual, this has a flow-on effect for their siblings as well.
Absolutely. And that was actually another question I've got to ask you, which is what are the implications for other family members? If someone comes back as a carrier for, say, cystic fibrosis, would you advise that all siblings are therein tested, especially ones who are planning on having their own children at some point?
Yeah, absolutely. In general, we don't recommend carrier screening for individuals who are under 18 or who have completed their families. But for those who are in the planning stages, we certainly recommend what we call cascade screening or family screening for these specific variations. We know that if a member of a family has been picked up as being a carrier, there's a 50% chance that all first degree blood relatives could also be a carrier. So if I were a carrier of CF, there's a 50% chance that my brother could be, and then a 1 in 28 chance that his partner could be. So while the meaning might be different for me and my siblings, it's incredibly important to share this information, particularly when the population carrier frequency is higher.
Absolutely. And Zoe, I think another sort of question I get a lot from couples is what's the difference in terms of getting a result prior to pregnancy versus early in a pregnancy? And obviously there is a significant difference in terms of what can be offered to couples to reduce the risk of having an affected child based on the timing of when we get a result. So maybe we'll start with pre-pregnancy couples. Say we've got a couple with who both come back as carriers for cystic fibrosis. What are their options?
Absolutely. So if a couple are identified at being at risk of having a pregnancy or a child affected with cystic fibrosis, there are a number of different options. The first option, which is always really viable and important to acknowledge, is that they may choose to take that chance and have their pregnancy managed in a tertiary service so that when that baby is born, they can gain the support they need. They can also reach out to support groups and learn about caring for a child with the specific genetic condition. There's also the opportunity to take time to think about what's important to them. We always encourage couples, if possible, to have carrier screening pre-pregnancy because it gives them time to evaluate what's important to them, what their risk threshold is, and what options they're open to. And for couples who are open to using technology or screening of a pregnancy, they can either conceive naturally at home. And there are 2 points in a pregnancy where you can test the DNA of the growing baby. So the first point is called a CVS or chorion villus sampling. It's a test that can be done at 11 weeks of pregnancy, where a small sample of the placenta is taken from the environment where the baby is growing, and a genetic test can be done on that DNA to identify the carrier status of the baby. There's a similar test called an amniocentesis, which can be done after 15 weeks, which does a similar thing. The important thing that we think about with diagnostic testing is that these results can take 2 to 3 weeks to come back. And that can be a really, really long time in a pregnancy journey. But ultimately, if a couple is choosing to do a test, it's because they may be considering termination of the pregnancy. And so they would need to be supported by their obstetrician or a tertiary genetics clinic as part of an obstetric hospital to support them through that process. The other option, if they're planning pre-pregnancy to have this test, is that they can use IVF technology and a specific test called pre-implantation genetic diagnosis. And what that enables is a specific genetic test to be worked up for that couple. And then they can use that test to screen the embryos in a laboratory environment. And then they would only transfer embryos that were not affected by that disease. And then there's lots of other things. So you can consider donor egg, donor sperm, donor embryo. Really nothing's off the table, but ensuring that couples understand their options pre-pregnancy is really, really powerful to help support them make informed choices. And every choice is the right choice.
Definitely. And that's what I always say. There's no one prescriptive answer that's right for every couple. And it's about taking the time to individualise pre-pregnancy and pregnancy management so that each couple makes the choices that are right for them and knowing they'll be supported through whichever of those choices they make.
Absolutely.
Can I ask for my own knowledge, Zoe, for each of the conditions that is screened for in Eugene, is there the option of IVF with PGD?
Yes, there is.
Great.
So for the 288 disease genes that we screen for, these are all considered by international bodies to be associated with significant diseases and based on the impact on the quality and potentially the length of life of a child. And so all of the diseases can be actioned in this way. Brilliant.
A couple of other questions that have come up on the screen tonight that I just want to check with you. In terms of the sample, I know you said Eugene can be done with a salivary sample and prepares often a blood test. What's the difference? Why can some be done with sort of saliva or mouth swabs, and why do others need a blood test?
Sure. So it's all about the lab preferences. So each lab will have developed an extraction technique that enables them to get the DNA out of the sample. For us, we really like the transportability of saliva. So we do work with a laboratory that's overseas. And so being able to move saliva samples around the country and internationally is much easier. Saliva is basically stable on the bench for months on end, whereas blood really needs to get to the lab within 24 to 48 hours for it to be viable to be tested. So not only the benefits of convenience and that it's not
Yeah.
invasive in any way,
Yeah.
we think that it's a really good option. The outcome or the quality of the DNA is no different, but
Yeah.
we do really rely on people giving a good saliva sample.
Brilliant. The other question that I think sort of confuses a lot of couples is the difference between genetic carrier screening and non-invasive prenatal testing in pregnancy. So looking for conditions like Down syndrome. Can you sort of summarise the difference between the two and clarify for people what the difference is?
Sure. So I guess the first things first is they're both genetic tests.
Yep.
And that's where the similarity ends.
Yep.
So genetic carrier screening is a DNA-based test, as is
Yep.
NIPT, but the source of the DNA is from the parents.
Yep.
The difference there with NIPT, the source of the DNA is theoretically from the growing baby inside the mother. And the two tests test for different things. So NIPT looks at chromosomes, which you can imagine are like the sets of encyclopedias that the baby has inherited from the parents. And if you, I always use encyclopedias. I know they're totally outdated, but I had them when I was a kid, and so that's important. But you imagine that you got 23 encyclopedias and a set from each of your parents, and NIPT screens for some major chromosome differences that can impact the health of a pregnancy or potentially increase the risk of miscarriage. And they include chromosomes 13, 18, 21, and sometimes X and Y, which are the sex chromosomes. Genetic carrier screening basically opens up all of those encyclopedias and looks at individual recipes or chapters, and they're what we call the genes.
Yep.
And so with us, we look at 288 of those genes, and they're the genes that we've identified as being relatively common within the community so that we can yield meaningful results. We understand those results really well, and we understand that if a couple were to pass on those variations, what it would mean for a child. And being able to explain that to a couple really clearly and help them come to a decision about what they want to do with that information is really important. There's absolutely no benefit in saying, we think we found this, but we don't really know what it means, so you can't really do anything with it. So having actionable information is really, really important, and that information being supported by your doctor is also important.
Great, thanks Zoe. And sort of to summarise for couples who are now looking at having carrier screening, they've heard you talk tonight and they're convinced that it's right for them, how can they access it? I certainly know in my practice, if I see a couple who wants carrier screening, it's very straightforward, particularly with Eugene. We simply email or fax off a referral to you and you make direct contact with the couple. It's very, very easy. If they choose to have Prepare, it's simply a blood test that they can do in our rooms, essentially, just next door. For couples that are watching this tonight and aren't necessarily, in Melbourne or seeing me in my practice, how can they access Eugene?
Yeah, so for us, accessibility is the most important thing. We know that not everyone's lucky enough to have amazing obstetricians at their doorstep, and some or a lot of Australians live rurally. So for us, for people who are wanting to obtain genetic carrier screening through Eugene, it's as simple as jumping on our website, which is eugenelabs.com. On the website, you can buy carrier testing either for yourself or your partner. You'll then be guided through some information where we collect a little bit of information about you and where you're at on your pregnancy journey. We then invite you to book in for your pre-test genetic carrier screening session with one of our genetic counsellors, which is, again, all done online. And then you'll be invited to access some of the resources that we've prepared so that you can be briefed about what it is so that you can make the most of your session with your genetic counsellor, where you'll be informed enough that you can ask questions that are meaningful for you. And basically, we ship your kits to your door, you spit 30 minutes after nil by mouth, and then you pop them in an express post back to us. So everything's all paid at once and all online. And then once your results are back, we invite you to book in for another chat where we go through those results with you.
Excellent. And those results also, as an obstetrician, come straight through to me as well. So I've got a copy of them straight away.
Absolutely.
which is really, really good. A couple of other questions, Zoe, that have come up from people watching this evening. Firstly, if a couple are identified at being high risk of having a child born with a condition, I'm going to use cystic fibrosis as an example.
Sure.
Both parents are found to be carriers of cystic fibrosis, and they have an affected pregnancy. As you said before, the chance is about 1 in 4. If they've had an affected pregnancy, is the next pregnancy still at the same risk of 1 in 4 of being affected, or does the risk go up because they've had one pregnancy that's already affected, or is it really luck each time?
Yeah, so there's a lot of luck involved in each pregnancy. Each pregnancy is completely independent of the others. And so while we would love to say if it's happened once, it will not happen the next 3 times. Unfortunately, each pregnancy is a unique event. So there's a 25% chance or 1 in 4 chance in each pregnancy you have or each embryo that's produced through IVF.
Not a problem. And Zoe, is it ever too late in a pregnancy to do genetic carrier screening? If I'm seeing a couple for their first visit, they've, moved from overseas or interstate, they haven't been offered carrier screening previously, and they're coming and meeting me at 20 weeks or sometimes later even, is it still the right thing for me to be doing to offer them carrier screening in that pregnancy? Should they do it after the pregnancy, before another pregnancy is planned? What would your advice to those couples be?
They're really tricky questions.
I find it a very difficult one to answer myself, and hence looking to you for guidance.
Sure. So in general, we're happy with any couple coming to us within the first trimester. So that's within the first 12 weeks, acknowledging that it can be up to 4 weeks before their results come back to them. There's limitations around how and when people can access terminations. In Victoria and other states around Australia do vary. And so we're really, really mindful of making sure that the couple understand the implications of those results, particularly if they're further along in a pregnancy. I know that we find it really hard to say no. So we find it really difficult to say to couples, it's too late, you can't do this test, because we think it's really important to understand what the motivations of each couple is. We certainly don't take it lightly if people are coming after 12 weeks, because we really want to understand what they believe this test will do for them and what they believe they can do with the results.
Yeah.
In general, we don't want to increase the anxiety of a couple if they can't do anything about it. And so, that pre-test appointment becomes
critical.
Really, really critical in supporting that couple to do what's right for them, but also making sure that if they are a little bit later in the pregnancy, that they've got the support of their obstetrician or a tertiary service, so that if something does come up and if they are really wanting to have that test, that they've got a network of health professionals that can support them, because that's where we have a boundary, so we can't organise testing of a pregnancy. And so we very much want to make sure that they've got the support outside of our team to do what's best for them. But certainly it's a critical conversation, and many, many people choose not to test later in the pregnancy because the options are limited, if none at all.
Yeah, I find it a very complex discussion to have with couples. So I'm glad you've echoed what I've said. So. Absolutely. Zoe, another question I get very, very often is, can we screen for autism and developmental delay?
So in short answer, no. So autism is a really, really complex combination of genetic environmental factors. There is one major inheritable cause of features consistent with autism and intellectual delay, which is called Fragile X, one of the 3 more common genes that we screen for. But in general, we can't exclude the risk of autism as an umbrella term. We know that paternal age can sometimes increase the chance of a child having features, or if the parents are more on the spectrum, so on the spectrum, you think about some really highly competent people, whether they be surgeons or accountants, pilots. The spectrum of autism is actually like a bell curve. And somewhere, as long as we sit to the left of that line, it can actually be really beneficial. And sometimes the combination of two highly intelligent people, or depending on the combination of a number of factors in the environment, that can skew that shift. But I guess simply we can't screen it out. And for a lot of people, it's a really valuable trait as well.
Absolutely. There's another question that's just come up on the screen that I'm going to ask you. So essentially it relates to twins. And if you are a twin yourself and you have a twin who has been screened previously and is found to not carry any genetic conditions, does that mean that you yourself won't carry them? I suppose it depends on whether or not the twins are identical or non-identical, you know, monozygous or dizygous, but I might let you address that question.
Sure. So there are lots of different types of twins. Twins that are identical in that they came from the same egg and same sperm generally have the same gene variations. So in short, if you're identical and your identical twin has had testing, you can presume that your results will be the same. But we always recommend, for safety's sake, that you will need to have that test because they are your results. And if you're going to action that result within the context of a pregnancy, you need your result. For fraternal twins or twins conceived from 2 egg or 2 sperm or any other combination, there is a higher chance that you will share the same gene variations, but it's not definite.
Yeah, excellent. So I think, Zoe, that sort of summarizes the topic really, really well. Thank you for, you know, making it so clear tonight for couples how they can access genetic carrier screening, what it means and what can be done about results. For couples who want to know more, what's the best way to get more information from you? How can they access your advice?
Absolutely. So best way to get in touch with us is jump online to www.eugenelabs.com. You can also give us a call. Our number's on the website. You can email us. You can SMS us. One of our clinical team will be very quick to respond to your inquiry and support you as you make your decisions about carrier screening.
Great, and I endorse all of that completely. I sort of make it clear to all my patients that carrier screening is optional, but I think they have to have, you know, the option of having it done to give them the information that allows them to make the decisions that are right for their family and their pregnancy. And as we said earlier, no two couples are the same, no two families are the same. And it's our job as genetic counsellors and obstetricians to make sure that couples have all the information that they can possibly gather to be able to make decisions. So, you know, thank you for supporting my patients so well. And we're extremely grateful for it. And I look forward to continuing to work together over the coming months and years.
So do we.
Thanks so much for your time tonight, Zoe. Take care.
Have a lovely night, everyone.
Bye. Bye.